I don't know what happened. It's, I don't know. Instagram had a moment and it kicked us off. So, sorry guys. But I don't want this to end early. I want to make sure that we're still talking about this super important stuff with our friends at Jope. So if you guys were in the in the live 3 minutes ago before our internet kicked me out, we were talking with our friend Dr. Christine. She is the head of Jope, which is a really awesome joint supplement company, and we're going to be talking about the benefits of some of the compounds that are in it. And so we're going to try to get working. All right, cross your fingers. Mauricio, what's up, my man? How's it going? I haven't seen you, heard from you in so long. Hope all is well, dude. All right, we got a bigger. They're back. They wanted more. They wanted to talk about it. Dr. Matt Schiffman is in the house, which is awesome. He works with me at DVM 360. You guys are a rock star. Awesome veterinarian. We got everybody back. Everyone is back. My fiance is here. She's not gonna abandon me. She's here. We got.
No reason.
All right, so where were we? Ashley Power is in the house, my co-resident mate and emotional support human at work. It's great. We've got an all-star group here. The internet had a moment. It's fine. We're good. Where were we? We were talking about how UC2 is super beneficial.
Yes, and UC2 is very cool. But you were chatting and I was listening, and then I went.
Oh God.
Dead.
Oh, I totally lost my train of thought. I think I blacked out.
No worries. It's the pressure of having to handle Instagram.
So yeah, it's true. It really does. It gets to you. This is stressful stuff. No, I was saying that it's really great that UC2 actually uses the body's own kind of immune system to truly benefit cartilaginous health and cause that repair, rather than just giving the body the building blocks it needs and essentially just hoping that it gets to where you want it, because that doesn't always work. And just giving the body the building blocks doesn't mean that the body's going to digest it, that they're going to absorb it, and that it's actually going to even be effective.
Yeah, no, that's very true. And I think it is a newer, it's a very new, it is a newer molecule overall. Like sometimes people, tell us, oh, well, it's been out for like 15 years, so it's not that new, but it kind of is, because not a lot of us are aware of it. And it is used in humans. So, that's also pretty cool. I use it every day. You can use it. The cool thing is, I think with that, and it's what we chatted about briefly, Dr. Danny, earlier too, is you can use it early. So there is studies that have been done with using UC2 and healthy Labradors and kind of evaluating their comfort after submitting them or having them go through more strenuous activities. So you had, there's a study where they look at 40 Labradors, Golden Retrievers, and they have them do a bunch of different runs, and then they titrate for, different types of inflammatory molecules in the blood or in the serum. And they also look at comfort and joint inflammation. And they show that when you're taking UC2 or when the dogs are taking UC2, they seem to be more comfortable and to recover faster and have a better overall performance. So that is also something, and I don't think you have those studies with glucosamine and chondroitin, at least in all the studies I've looked at, I haven't seen it. So that is pretty cool. And you might like it as, a sports medicine fan and expert.
So wait, so you take UC2 as well?
Yeah, I take it every day. Honestly, since I started, when I started with my dog Pepsi, that's when I realized at the time I was kind of using a human one that I had found as a capsule, and I take it every day because I work out a lot, and I just, I live in New York City, so there's a lot of pavement when I run outside. I'm not running in the beautiful, rolling hills. I'm running in the how do you say that? The concrete jungle, or the jungle of concrete?
Yeah. You got it.
So I want to make sure that, my joints are protected, and I take it every day just preventatively, because I would love to be able to walk and be free.
Sure.
I'm 100 or 90 or however long I'm going to get to live. So that's kind of the idea. You can also use it in horses if there's any equine fans. It is also very helpful in horses.
Okay.
And then cats. So you can actually use it in cats too. And our product is safe in cats, in case you're wondering.
Very cool.
And it is those for cats too.
I think I'm gonna have to start splitting some of my joke chews with Mongo. He'll get one, I'll get one.
Perfect.
That's
they
great.
Taste not too bad.
We did this surgery yesterday where we were in like the most awkward position for so long, and then this morning we both myself and my senior surgeon, we looked at each other like, oh my god, like we got to go to a chiropractor. We need some Advil, like stat. We were in a bad situation. Or like her neck was like all contoured. I'm like standing basically on my head, holding this leg that's like bent back like that. It was wild. So all right, we need some UC2 in our life. I like it.
You can eat our chews. We've tested them. My partner actually loves to eat them. I tell him not to eat our stuff. You know, it's like #1 rule if you're going to be a product manufacturer.
Yeah.
But they taste pretty good. So they don't have any meat, by the way. They're vegan. So not that we think dogs can't eat meat, but they have a meat allergy. You can give it safely. So I think that's awesome. Yeah.
So I know we also did we have any other things that we wanted to cover too? I know we had some questions that were also submitted. Or if there are any other topics you wanted to talk about, any other awesome things about JOPE or UC2 that we should cover?
I think we covered it, high level, but if anybody has a question after, they could reach out to you or to me or email us or, get in touch, and we can give the detail at the end. But did you want to address quickly the questions you got, just so
yeah, absolutely,
we can take care of it?
Yeah.
Even though it's not really joint related, but we can still have fun with it.
Yeah. So these are submitted online the other day. So we have 2 questions from the friendly vet. Actually, is he here? He's not here. Oh my god. What does he even care? So he had a question about Emer slings, which basically the goal of an Emer sling is it's typically placed in dogs with some sort of a hip injury. So the most common situation will be a dog with a luxation of the hip joint. So most commonly your hip will luxate. So this is the ball and socket joint of the hip, and this is the ball and this is the socket, or your acetabulum. It luxates craniodorsal, and so the dog's gonna step down and it's gonna pop up and forward. So in certain situations, you have to do a surgery, right? The dog's it's been out for a while. You've got arthritis there. It's got hip dysplasia, whatever that predisposed it. So you can't do what's called closed reduction. But in certain situations, you can, meaning you have your hip joint up here. I'm trying to make it so the camera actually sees it.
You're great at mimicking.
Can you tell? You orient you kind of rotate the leg and you pop it back into the socket. But the reason why I got there, right, is because you have tears to part of your joint capsule, to the round ligament of your femoral head. And so if you just left it there, it's just going to pop back up because there's no stability there anymore. So you put them in what's called an Emer sling, and that helps reduce some of the pressure of the hip joint to help keep it in place. So their question was, are Emer slings a thing of the past? And absolutely not. No, we use them all the time. Anytime we're doing closed reduction in a craniodorsal luxation case, we'll put them in an Emer sling, and they're going to be in there for probably like 2 to 4 weeks, depending on the case, to allow that kind of scar tissue to develop, to allow the joint capsule to start healing a little bit, and allow some stability to come back to that hip joint before we then allow them to bear weight on it. So that's super important. But even more important to know is that you can't just use that for any hip luxation. So craniodorsal is the most common, but it can also luxate caudoventral, and so it actually pops down below. And so that's going to be from like getting your leg, they get their leg caught in something, some other injury that pulls it below the hip socket and actually gets caught in the pelvis. If you put them in an Emer sling, it does not work. That's not how basically they looked into like forces of how everything is lined up. You have to put them in hobbles actually, so you can't use an Emer sling in that situation. So it's really important to not just use an Emer sling anytime a hip is luxated, but to choose it for the right case. So
Okay.
Summary, no, they're not a thing of the past. Super important still in the right situation.
For the right case, correct.
For the right case, yeah. So for the right type of luxation, but also the right dog, right? And so if you have a dog that has crazy hip arthritis and the hip has been out for a long time, well, then the muscle is contracted. You've got scar tissue that's already formed. You've got soft tissue that's already filling in that empty acetabulum, or you have a really flat joint anyway. So a nice ball and socket, it's got a good cup. It's going to stay in there and it's going to pop in there. But say you're a 10-year-old Labrador who's have awful hip dysplasia, well, your cup goes from this to this because it's already filled in. Nothing is going to keep that in there. And so something like close reduction is not going to work in those cases, which you're then going to reach for something like a total hip replacement or an FHO or something like that, or conservative management. And you don't always need to do surgery for those situations. About 70% of them can be managed conservatively. So super, super important to know that there's a lot of options too, and they would be a great candidate for joint supplements.
I was gonna say
helping them out,
but you beat me to it.
yeah. And then the next question, also from the same person, was what bandaging technique should every ER or DVM know to learn and love? And this is a lovely pedestal I love to get on, because I am a huge proponent of learning how to make splints, customized splints with fiberglass. And so there are a lot of like one size fits all ones where you they're already pre-made and they're plastic and you just slap them on there. Say it's a radius and you slap it on there like that. There I go again, demonstrating on camera. I don't know if anybody knows.
I love it. I'm about it. Like it's great.
a caudal spoon splint like that. And then you bandage it and you're like, great, your fracture can be managed with this splint, or it's stable. No, it's not. It doesn't always work that way. Yes, certainly there's certain circumstances where it's better to do that. In a busy ER setting, you don't always have the time to make a fiberglass splint, but if you do, it's worth it, right? You can actually customize your fiberglass splint to fit the concavity and the curves of a dog's joint, because you can't always get it straight, or dogs will have different anatomy, different curvature. Good luck getting a one-size-fits-all splint on a freaking dachshund leg where the leg naturally is like in this orientation. Like, that's not going to work. Same thing for a French bulldog. Like, yeah, maybe it'll work well for the Labrador with like normal straight legs, but learning how to make a customized fiberglass splint is going to be super, super helpful so that you can get the best fixation for your pet. Learning how to make it so it's not going to slip, and just knowing how to just typical bandaging techniques, placement of a soft padded bandage is an invaluable experience so that you can give that patient what they need, so that if they're going to do surgery, if you're going to try to manage it conservatively, that they can get to that next step. Because it's almost doing more harm than good if you place something like a splint or a bandage and it fails immediately. It slips down to the bottom of the leg, puts all sorts of weird torque pressure on the leg, and you went from having a fracture that's unstable to now a fracture that's unstable with a weight hanging from it because now the leg's flopping around. It's awful. So learning how to do a standard soft padded bandage and a custom fiberglass splint, and you will make every single surgeon the happiest person on earth.
Okay, noted. I'll tell people when I meet them that they must do that to make surgeons
Let them know. You heard it here first on this Instagram live on this date, 7:57, June 21st. Learn how to do those things.
It's the first day of summer. Yeah. I'll quote you. Don't worry.
Perfect.
First day of summer. It's.
That's it. And then the last question that I had is actually related to GDV, or gastric dilatation with volvulus. And they asked, what is the recovery for a turned stomach or a GDV? So what I'm presuming this person is asking about is how long does it take them to recover, and like what things are involved in that. And that's obviously a little bit of a tangent from our orthopedic conversation, but I'm a surgeon. We deal with surgery all the time. And so this is a very common emergency that we see come in, and is a surgical emergency by definition. They need surgery. And so the goal, what happens in a GDV in kind of broad spectrum, is that their stomach will fill up with gas. And it is most common in your giant breed dogs, like, you'll have your Great Danes, your Irish Wolfhounds, German Shepherds, stuff like that. and it's all anatomy that predisposes them to this, and their stomach fills up with gas and then it twists on itself, and that twisting is what cuts off blood supply. And the goal of surgery and therapy is to decompress the stomach by manually derotating the stomach to relieve that cut off blood supply and spare the other organs that can get entrapped in that. And then you do what's called a gastropexy, which tacks the stomach to the body wall so that it can't flip again, because they're just going to happen again if you don't do that. And the recovery from that is going to be based on how well they recovered from surgery and anesthesia. So they can get really, really sick. They can have tons of comorbidities that happen, anywhere from systemic inflammatory response syndrome like SIRS, or they can have arrhythmias, they can have VPCs and VTAC. All these things play into it. But for argument's sake, if this is a very standard recovery and you do surgery and it does well, which most do, honestly, most do well with surgery, the recovery from that is going to be about 2 weeks. And that is just waiting for that incision to heal, making sure that you're keeping that e-collar on them for the first 2 weeks, making sure they're staying exercise restricted, staying in a playpen, small playpen, or a cage, depending on the size of the animal. And then during that time, the only time they're outside of that cage or playpen is to go to the bathroom, and they're on a leash that whole time, so that they can't, if they see a squirrel, they don't dart across the yard and undo all those sutures. So that's going to be super important. And once your dog is recovered from that surgery and that incision is healed, they're done. Like, they are good to go. Once you're gastropexied, you're not going to get a GDV again. That is not a thing that happens unless the repair fails, which I've never witnessed. And so that's basically what that recovery looks like. It's 2 weeks, keeping them calm, managing whatever other comorbidities may have happened as a result of that condition. And that's about it. And then your dog's good to go. And even more importantly, you can prevent this entirely by gastropexing your dog when they get spayed or when they get neutered, or just scheduling a prophylactic gastropexy with your friendly neighborhood surgeon, and we'll do it for you, and we'll prevent this condition from ever happening. And I love it. I love it when people do that, because it is so worth it.
It is life threatening. I think, that is something, right? Once the GDV is happening, it's a question of hours. And so I think it is important.
Yeah.
Sometimes not even hours.
A surgical emergency by definition, and they can die at any time. It is a super scary thing for pet owners to have happen to their dog. The biggest things are getting decompression of that stomach. And so there's actually a recent change in the way we think about this condition. The initial mentality was, the faster you get them into the OR, the faster you derotate that stomach, the better they're going to do. And that is true to an extent. But the more important thing is that you're decompressing the stomach and that you're stabilizing them. Because if you take a dog that is having raging arrhythmias, it's in VTAC, it has a lactate of 400, they're wildly dehydrated, their blood pressure is all over the place, you try to put that animal under anesthesia, they're going to die. It is not okay. And so you can do things like trocherizing the stomach to decompress the stomach. You can pass in a nasogastric tube to decompress the stomach, or you can anesthetize and then pass an orogastric tube to drain that air from the stomach. And it's really that decompression and relieving that pressure that gives you that biggest benefit. And more importantly, it gives you time, because and then the ideal goal is getting them into the OR once they're stable. And so there's a study that looked at dogs cut before and after 6 hours that got that stabilization, so decompression and symptomatic care, and there was no difference in survivability. And so it's still an emergency to get them to the hospital, to get them to a place where they can do surgery. But then once they get in there, you got to make sure that they're stable so that they can get the surgery and do well afterwards.
Yep. It's a scary one when you see one coming your way. At least for me, when I was practicing, I was like, surgeon. That's where you need somebody that knows how to handle those cases.
What else? Those are all the questions that I had on that were submitted to us. Thank you guys so much for submitting those. Also, it's been super awesome seeing so many people come through this waiting room. We've got a ton of people that are super interested in this, which is always really, really great to see. Were there any other things that you wanted to cover while we were here?
No, again, just extend our appreciation. My partner couldn't join us, but we're super happy, Dr. Danny, that you gave us the time to chat and answered questions, and went over surgery, recovery, supplements. We even dove into GDV.
Oh yeah.
So unexpected, but very cool. I guess if anybody has questions about JOPE, hip and joint dog shoes. Oh, maybe very quick. JOPE stands for Joy of Pets too. I don't know if I said that, but we did,
I love that.
choose the name just to illustrate how much the human and dog connection can be, or cat connection, your pet basically. So that is why we're called JOPE. And if anybody has questions or comments, they could message they could message us. Our website is petjope.com. Our Instagram is petjope, and they can also reach me at christine@petjope.com. Not too hard, or DM, or basically anything, but don't hesitate to ask. And I think for you too, right, Dr. Danny?
Absolutely. Yeah. So if you guys are on this live, just click that button right up there. It's right around there. I don't know if I'm the top video or bottom.
Yeah, you are.
Either way,
you're the
at the top, you just hit that little arrow and it says who's in this room, and you just follow us both, and then you can ask us whatever questions you want. So the best place to find me is on Instagram. So at dr.danny.sack, and feel free to reach out with any questions. I'm always super happy to talk to pet parents, veterinarians, whatever you guys want. I'm here for you. Make sure to pick up your JOPE supplements, and you can find that information on their website. These are Mongo's new favorite thing. He loves them.
We love mango, so
you can literally see his drool the second you open the bag. It's like a waterfall. It is disgusting. He loves it. And then we also have a super sick discount code that we can offer you guys too, right? If you wanted to sign up, you get your JOPE on. It would be amazing. So I have a discount code. You just enter dr.dannysack, just my regular username up there, and you get a discount on your bags of JOPE. Get your animals comfortable, see how well UC2 can benefit your pet.
Yep, and long term is key. So don't hesitate to ask us questions. Like if it's why, and you just want to ask questions and be sure you're confident with the choice you're making. Happy to answer.
Absolutely.
Anytime.
Yeah, and without question, you are a freaking genius regarding this stuff. I remember when we first started talking, and you sent me all this stuff and all this literature on how beneficial all this stuff was, and I was like, oh my god, she is a total supplement nerd. You got this down. It is amazing. It's really, really cool. It's awesome. I love talking to you about all this stuff, and it's really, really cool to see how much evidence is going into the compounds that are in this supplement. And we talked a lot about how the amount of work a supplement company puts into making sure their product is valid, that they have a guaranteed analysis, and it's actually doing something for their pets. That is super important. And it's really, really great to see coming from JOPE. So I'm super excited to see what literature comes out about it.
Maybe a study, right?
Maybe a study, maybe a couple studies.
Maybe
I don't know.
2
We'll
studies.
See. Yeah. So I think I'm really excited to see where this goes, and so excited to be working with you. It is awesome.
Thank you, Dr. Danny. Good luck with the rest of your evening. Hopefully no surgeries last minute. But if you get an orthopedic one, don't forget, recommend JOPE. I'm kidding.
You got it.
Thanks again.
Well, it was so awesome chatting with you. Thank you so much.
Thank you everybody for joining. Yeah, really appreciate that.
All right. We'll talk to you later.
Thank you.
Bye.
Bye.